What's up, everybody? Dr. Giraffe Gainz here. Thanks for the click and welcome to the podcast. I hope you're having a great day. And if you're not, let's go ahead and finish that day great. Don't forget to like, comment, subscribe, but most importantly, enjoy the podcast. Hello, everyone. My name is Jacob. I'm a student physical therapist at Northern Arizona University. I'm here with my colleague Isaiah today. Isaiah, if you could just introduce yourself briefly, and then we can get going into the meat of this podcast.
All right. Yeah, so as Jacob mentioned, we are both students currently in the same cohort, the current and inaugural cohort of the NAU hybrid PT program. So we've been in this now 11 months together, going on, finishing up a year. But before PT school, I came out of GCU, did some time in like the strength and conditioning world, and now we're here. So that's where we're at.
Awesome. So why don't you start out by telling me a little bit about your experience in the hybrid program, maybe a little bit about how it differs from typical residential programs. Just tell me about your hybrid experience.
Yeah, so as far as how it differs from the typical model, I mean, obviously I haven't been in a on-ground PT program before, but having a lot of peers from undergrad and from work experiences that are currently in those programs, we've had a lot of conversations about how they kind of differ, and particularly with like the competency-based system that we're underneath, which is a little bit different than majority of the ways that we have recognized school and the learning process to occur. So I like the difference because there's so much more of a emphasis on, do you really understand how to communicate and implement these systems and these topics and these skills, rather than can you intake and regurgitate some information on a test and achieve a certain percentage over the course of your curriculum. So sure, we'll get to it a little more, but the EPA system that we're under, in short, is a collection of important skills that our faculty have decided that are the most important things for us to have in our tool belts, that we'll need to use on a daily basis in treatment and PT practice. And each one of those things we make progress on individually across multiple assessments, and rather than just, here's a class, study this class, pass a test at the end, move on to the next. It's a little bit more cumulative and all-encompassing and practice-based, which has been really cool so far. But
yeah, I mean, obviously that's what I've been through as well. I think the cumulative aspect of it and the focusing on those EPAs, which we are going to get into, I think that makes it a lot more salient to us, rather than this is your neuro class, you're going to learn about the brain, you're going to learn what it does, all that. It's, yeah, you're learning neuro content, but how do you implement that into what you're going to be doing in the clinic? So let's just jump into the EPAs, since that's what we're going with right now. So Entrustable Professional Activities, EPAs, we have 9 of them. We got number 1 is gathering histories and performing physical examinations. Number 2, establishing physical therapy diagnoses and prognoses. Number 3, developing patient-client management plans. Number 4, establishing patients' and clients' individualized exercise prescription. Number 5, implementing the interventions of a physical therapist. Number 6, performing re-examinations to inform the patient-client management plan. Number 7, documenting clinical encounters. Number 8, transferring the responsibility of care. And number 9, providing oral summaries of clinical encounters. So my experience with these so far, those 9 tasks are, it's really just outlining the plan of care that you go through with the patient as a physical therapist, from first thing, starting with the history, all the way to providing that oral summary at the end. I think it's really helped kind of guide an understanding of how real life practice is going to be rather than kind of what you're saying, just the regurgitation of information. So why don't you tell us a little bit about how your experience with the EPAs has kind of guided your educational growth and professional development?
It's been interesting because often in academic programs, uh, as you said, with the way that things are broken into classes where you're focused on that class one thing at a time and then you move on to the next. It's a lot different because ever since day one and even before, like in our orientation for the program, they presented us with all these EPAs and that let us know like, okay, there's little domains of competency that these fall underneath that you need to be really, really, really good at. And each one of those things is kind of like a reference point on like a North Star type thing where like in the middle of your curriculum, whether we're in a certain, topic for a time, because we don't have classes, but we have portions of curriculum that do all line up together. Like we're in neuro for a little while, we're in ortho for a little while, we're in for example, like we have pelvic floor starting for the first time tomorrow, and this is becoming new. So it is kind of sectioned off in a way, but that EPA system where we've had these 9 things, these listed individual items that we can look at over the course of the program, so the last 10, 11 months, and every single one of them, and we do this on a semesterly basis where you look at each one of those skills and rate yourself in terms of your confidence to deliver on those things. And it's really cool because at each one of those, checkpoints, as you kind of watch your own progress, and even if you take little self-assessments in between those major ones, you kind of start to get an idea of which things you need to work on personally more than the others. Because some of us, especially from uh, past experience, like we might already be good at a couple of those things. Like I know you and I both with our like training backgrounds, maybe that exercise prescription and like the developing a personalized training program, like that kind of thing for patients, we're probably already pretty good at. But some of those other things, like for example, like reassessment or transferring plan of care onto the next healthcare professional, like those kinds of things aren't something that we might have quite as much experience with. And then as we move through this program, you kind of start to see which things you need to work on more so. And it's cool because all of us have different strengths and uh, especially earlier on weaknesses. I mean, we still have some of those now, but we'd like to think that they're all becoming strengths, but each at our own
So
pace and in our own way.
yeah, slowly but surely for sure. Um, I mean, I would second that, and the fact that all 30 of us, there's 30 of us in our cohort right now. All of us have come into the program with different strengths, different areas where we need to grow more, kind of different aspects of each of those 9 EPAs that we are comfortable with or that we've never once seen before and never even practiced it. So that reassessment and kind of having those 9 like North Stars, like you mentioned, to guide us on our journey to becoming physical therapists has been pretty awesome to me, honestly. Pretty just makes it make sense on where you're going to, where you're trying to get to. You're trying to get efficient at like number one, gathering the history and performing the physical exam. So you're grinding out reps with doing that, and you can see your growth in there, and then you can kind of see how you're fitting everything else into the plan of care as well. So going from the EPAs, why don't you break down how our classes are broken up and how we've kind of gone through the semesters with the same classes but differing content?
Yeah, so your typical PT program, I have a friend who's in Franklin Pierce's hybrid program currently, but it's not a hybrid program that's competency based in the ways that ours is, or nor does it have the same kind of class division system, which I think is kind of particular to this competency based system. So even under their hybrid program, like it's They have a neuro class. They have an evidence-based practice class where they're doing statistics for 12 weeks straight. Like there's all these little individual things and they're taking 6, 7, 8 at a time. But the way ours has been broken up ever since day one, our first semester was movement sciences one, semester one, patient management one, and contemporary practice one. And each semester that course split has stayed the same. We've had the same 3 classes, just onto movement sciences, patient management, and contemporary practice 2. And now we're in the 3rd semester. We've pushed off contemporary practice 3 into our 4th semester, so we're focused on those 2 right now. But while it's only 2 classes, I believe, I don't know off the top of my head, I think we're somewhere in the mid 20s as far as course credit is concerned. I mean, it's kind of relative. At the end of the day, like each course is really blended together and on into the next semester. So we're never really completing a topic and leaving it behind. We kind of got the building blocks in the first semester in MS1 and PM1, and now in semester 2 and then semester 3, we've kept a lot of those same like systems and a lot of those same topics, but we just build on them and build on them and build on them. And as we move further into the program, it becomes less theory and more practice, more skills, and more how do you interpret this information that you figured out how to get in the first semester or 2, and what do you do with it from there. So I like the way it's laid out because I don't feel like we're in finals prep mode right now, right? And we're going back to, it's a cumulative final for the entire year, but I don't feel like that semester 1, semester 2 content is just gone like I would in previous education models where you just have a class, you take a test, and you're done. Because we keep building on it, like we keep bringing it back. Obviously, there's little pieces here and there that you got to bring back to the front that you haven't really thought about, but the way that it's built on each other semester to semester, and then we go off and we'll apply in clinicals in January and then come back and learn some more. It's a continuous process that I think really helps to cement things that don't really work that way in other education models. But
Yeah. I like the continuous aspect of the learning has made it, I mean, I'm in the same boat as you, to where preparing for this cumulative final has been easier than you would typically expect because you're constantly reusing and constantly revisiting that information. You might have to help me out with this a little bit, but like movement sciences one, we really hammered home the anatomy and physiology, went through our whole muscle library, which is, I mean, head to toe, all the muscles, everything. And then patient management one, I really remember hammering in EPA one, which is the history, the systems review, kind of introducing the patient care in a sense of what information do you need, how are you going to get it, how are you going to deliver on that. And then moving from there, movement sciences 2, we really focused on the cardiopulmonary aspect of it, kind of obviously the cardiopulmonary systems. And patient management 2 was more interventions for breathing, interventions for cardio, interventions for lymphedema. Anything I'm missing in semester 2 there?
now that you're listing it off.
Yeah. But now in semester 3, it's kind of really all wrapping together. We're going through a ton of specific differential diagnosis clues. And like when we do that, like when we went through the shoulder module, we brought back semester 1's content around the shoulder, all the muscles, all the anatomy, all the physiology and everything. So going through kind of section by section this semester and reincorporating all that previous information has, I mean, like we both mentioned, kind of reintegrated and helped us review as we go. So I feel like this method of education has been, I mean, wonderful for me. Obviously, this is the first time I've seen it used.
Yeah.
I can't really picture going through PT school without it right now. Obviously, like, because I haven't done it. But I don't know. I think it's been very beneficial for us. Do you have anything else you want to add to that topic there?
I mean, the big thing with semester three, I think, especially in the patient management side, has been the case application. I mean, we've over the course of the semester, I think it's something like 28, 29, 30 cases, something like that, where, and I believe all of them are based on real life cases that each of our faculty have treated in the past. Yeah.
Yeah,
Yeah.
that's the gist that I've gotten from it for sure.
Yeah. So while we might not have like a pro bono clinic where you're actually doing it yourself, like they do at the Flagstaff campus, we have those mock patients where, and I think the coolest part about that is you get all the information on the patient and you can see like the entire course of care. You have all the time to review it and think about it and pick out things that you don't fully understand really well when it comes to like the pathophys and maybe like topics that you need to review from previous content. And you can kind of prep that stuff going into the synchronous sessions where we discuss them and break them down and we toss ideas back and forth at each other and come up with a plan of care together and get criticism from our peers. And we get some adjustments from the faculty and they suggest new ideas. And sometimes they even take ideas from us and give us like their 2 cents on the things that we're coming up with that they haven't really thought about before. And it's a really cool, just back and forth, like constructive process where we're all collaborating on this patient case and it's not just completely done in isolation. So there's a lot of opportunity for learning there too.
Yeah, I mean, follow that up with the fact that we are going through the cases before, or going through the cases individually on our own, using our ideas and working through kind of videoing. I mean, we've been submitting video submissions of taking the history for the patient, performing the physical exam, doing every one of those 9 EPAs in different forms throughout the semester. But doing those all on our own and then going to that synchronous session, sharing our ideas, bouncing them back and forth off of each other. And my question for you is, what do you think the synchronous sessions, when we do go through those cases, just kind of tell me about the format of them and tell me about the true benefit of them.
Well, they don't always, they're not required. So that was a point that was made as soon as we started the program, is that these are here for your benefit. They're not a requirement for you to attend. And I think early on, everybody's like, oh, it's not a requirement, right? And we all got in and checked it out, and eventually some people started like utilizing it a little less. Maybe they weren't attending every single one, but I think over time, like everybody kind of had their moments of utilizing the sessions and then not utilizing the sessions and kind of experiencing how the learning process gets easier when you are involved in those circles was really cool because it made it very clear, at least to me, because I did a little bit of like taking a break from sync sessions, especially when I was traveling for a couple weeks and then coming back and trying them again. And oh my gosh, like it made everything just sink in so much more because it's just another exposure to the material. Like at the end of the day, you need to be exposed to material. I think it's 7 times before it really imprints in your brain. So just in that sense, it's great, but like the opportunity to talk through things and not just be reading off a page and writing notes and all of this, but communicating between peers in that synchronous session format where we all come together, we get a little presentation on some info, clear up questions and things that maybe we didn't really understand in our independent study and get that cleared up. And then they break us out into small rooms where we can, typically we have like a task to work on, like coming up with a plan of care and doing that together. So then that session becomes mini sessions where we're working together and building these things and coming up with ideas, having those small conversations where everybody has a voice, and then we all come back together and present it to the big group. And then that's where some of the constructive criticism goes, some of the adjustment, like giving new ideas, things like that. And you get to hear what your other classmates came up with, what your other peers came up with, and then think, oh, how did they get there? I didn't think of that. And it just kind of like brings all these new ideas in, which is a really cool thing to experience. But yeah.
Yeah, like Dr. DeRosa says, it's the opportunity to intellectually joust with one another. So, I mean, even today's sync session, our faculty purposely told us, like, throw some dirty questions at us, like throw some hot topics up in the air that we can debate surrounding the top or content that we were going over, so that we have that opportunity to dive in and discuss and kind of go head to head with our ideas and learn and grow from that opportunity, which is very important for everyone's professional identity, or professional development, I feel like, in learning and educating, but being able to discuss, because I mean, in our field, you can look every single direction and there's a different way of doing something, there's a different way of thinking about it. So that opportunity to discuss and collaborate with 30 plus whatever faculty members are in that class is very beneficial, I feel like. And like you were saying, kind of sometimes you experimented with taking a break from the sync sessions, where when you are on board with them and you're going consistently, you're gaining that benefit and you're really understanding what's going on, getting that extra repetition in there. So kind of transitioning slightly, we've talked a little bit about the format of our program, about how we do things. Let's talk about what we're using to complete these. So some of the technology, as we are a hybrid program, what kind of technology are we using? Tell us about the teams, tell us about the meetings, tell us about Canvas, tell us about all of it. Go from there.
Phew. All right. Well, yeah, I mean, we'll start from the top, I guess, with good old Canvas. I mean, it's not something that's specific to NAU. Like it's very common across a
Yeah.
lot of different schools, but that's kind of like our hub, like our central place for all of our content, all of our announcements from faculty, those submission boards where we can review or receive feedback on our techniques and things like that. That's kind of our center place. But I mean, if I go down the list here, I've got like a bookmark of all the sites we use between our Top Hat site for quizzing in class, where we're running through new content within a multiple choice test based format, which is somewhat similar to NPTE style. So we're in the habit of getting good at those things. I mean, we've got the clinical pattern Physio U platform where we have access to every intervention and assessment and you name it. Anything under the sun PT, you can find in some sort of video tutorial format there. Access Physio, Acklins, like we have a lot of supplemental resources, textbooks and like testing platforms there as well. We use a couple big sites like ANPT for all of our neuro, like core practice guidelines and things like that. I'd say that's the large chunk of the resources we use on the web. But I mean, in addition to that, we've had VH Dissector was originally like our first one, and now we have Complete Anatomy, right? Where we have essentially like a digital cadaver, which I mean, you can do a full dissection on any system that you need to, and there like that. That's a tool that we have at our disposal in place of like an actual cadaver lab where you would likely have at most on-ground campuses. And what's funny too, having in my undergrad, I was fortunate enough to have a pretty extensive exposure to cadavers and up between class and some research programs and things like that. And I really don't feel like we lose anything by having the digital version versus like a real uh, cadaver in front of you. Obviously there's like the tactile piece and you really get to experience things in 3 dimensions and move things around and stuff like that. But I mean, at the end of the day, you're not going to see that inside someone's body in the PT field, unless you're in, some sort of like wound care thing. But uh, yeah, aside from that, I mean, then we get into our favorite piece of technology that has been blowing up as of late, um, with AI, ChatGPT, even what we've got going in here now. I don't know if you can see it, but it's called Fathom AI Note Taker, which essentially will join a call like this, Teams, where we have all of our synchronous sessions as an additional guest member and run a recording of the meeting. And then what it does is builds out a summarization of the entire conversation in a note format, like a bullet point note format, where each bullet point section on a topic that was discussed has it's linked to that section of the video. So what I found that useful for is if we're going through, because sometimes like our movement sciences and our PM classes, like we're just going. Sometimes there's like a couple things here and there that they just don't stick if you're just listening right away. So we have those recordings to go back to, and if there's something you missed and you didn't really get, like for example, at night before you go to bed, you had a bunch of sync sessions throughout the day, just jump on there real quick and I don't remember what we were saying about. I mean, what's something? Yeah, I don't know, like that pelvic floor content that we were going through. What was that? Like, what was that disorder called? Like, how does that work? And you just boom, click on there. You can hear that 2 minute blurb that you forgot about. Review it real quick, and boom, like there, boom. There's your second, third, fourth exposure to the content. You're already halfway there to imprinting that in your brain. But um, I think the biggest thing with AI that, I mean, aside from the voice feature that we've been playing with recently, has been like streamlining things and being efficient and pulling things together and compiling information quickly. Because especially in a hybrid format where you're not in class being guided through things all day, a lot of our stuff is independent. It's really easy to get stuck in the where do I find this information place where, I mean, for example, if we're going through a research article on like the rotator cuff tendinopathies, we had a ton of those when we were going through the
Yeah.
shoulder. And all these studies are 10, 20, 30, 40 pages long. And it's so easy to jump in those. And yeah, we're pretty good at like scrolling through and finding important sections and just reading what we need to read. But even then, you open one of those up and like start reading, and you look back at the clock and you're 45 minutes later, and all you know is that like non-painful shoulders often have like a torn rotator cuff by themselves. Like, I don't know, like you get 45 minutes into something with that research, and really what I've been using it for as of late is just throwing some of those in there and getting like a summary and key points, and then specifically like actionable items as a physical therapist to spit that stuff out. And now you spent 3 minutes on that. You've got all the same things, if not more, than you would have by reading the entire thing. And if you feel like you need a little more clarity on it, you can table that and come back to it when you have a little more time and continue on with the content. So it's really streamlined like the study for me. And then, I mean, we can talk about how we've been using it for, you know, tests
Oh, yeah,
and
we'll get there for sure.
yeah, all that stuff. But
Yeah, even with the like, let's start like stick to the research summarizing right now. You throw the research article in there, you get that summary back. Even like you were saying, if you do feel like you still need to go back, you have those bullet points to go back to the research article, search for those keywords in there, and then you can reread that same section rather than scrolling through the 30 pages and reading it sentence by sentence, looking for that specific piece of information. So it's a huge time saver, especially our hybrid program is accelerated. So obviously we're moving through things like you were saying very quickly. So you need to be efficient, you need to save that time, and you need to find the best ways to do so. And like you were mentioning, the way we've been using it to study recently is we've been asking ChatGPT to come up with an NPTE style quiz for us, and we've been telling it the topics to utilize, and we've been using topics from our course this semester, telling it like give us case examples and tell us like differential diagnoses, best interventions for those diagnoses, whatever it might be. And it spits out however many questions you want. It spits out exactly what you want, the way you're looking for it. And then you go through, you get immediate feedback on your answers, and you can kind of just grind the repetitions out again, just very quickly, rather than having to spend the time typing out flashcards, coming up with your own questions, whatever it might be. You get them, I mean, in a split. You press enter and they're all there. So why don't we talk a little bit more about, I know you use ChatGPT when you're going through the async content for the first time. That's correct, right?
Mhm.
So tell us a little bit about how you use it when you are going through the content.
Oh, we got you. Yeah. So that's something that my fiance in the program does a lot with her note-taking system. That's been a little bit more her thing recently, but um, again, another way to just like give you an additional exposure to the content in a like a simplified and shortened, summarized way, and then streamline the process because all of our content is in PowerPoint slide decks for the most part. And they all those PowerPoint slide decks come with a pre-recorded video with one of our faculty flipping through and presenting themselves. And a lot of times that comes with some additional information when they're, going through with their own clinical expertise and background and things like that. But um, the expectation is that we go through all of those videos prior to certain sync sessions to be prepared and things like that. So typically the way it works is jump into those pre-recorded videos, take notes throughout. But something that we've been doing with the ChatGPT recently is plugging those PowerPoints directly into the engine and having it spit out summarized like bullet point notes, basically, like fairly simple. And then now you have like this foundational like framework to work through as you listen so that you can get a little bit deeper in the notes. Because a lot of times what ends up happening with these pre-recorded lectures that are, say it's 20 minutes. I mean, we've had some long ones, like there's 45 to an hour minute videos every now and then. But say we've got like a 20-minute video, you get a couple minutes in and keeping up with writing or typing or whatever your note style is, and you are writing something down and you hear another good thing that you want to type and you kind of miss it. So you have to rewind, you have to pause, you have to find where you were. You go through that again and okay, now that's what I need. And then you pause again and you write that down and you hit play. That 20-minute video, you do that enough times, that turns into 40 minutes, an hour, 2 hours. Like, so what's helpful with that AI summarization beforehand is now you have like the scaffolding of the whole thing. And as the video's playing and you're thinking through things that you want to note down and you have this framework in front of you, you can kind of take things out, put things in, add new notes, highlight some stuff that you think is more important from that framework it gave you, and just build around that so that 20-minute video is actually a 20-minute video. Or who knows, even less if you put it on like 1.25, 1.5 speed. But yeah, again, just a lot more efficient that way. But
Yeah, and even with that, that's two times going through the content. Essentially, you get the summary, you breeze through it, you get the bullet points, you have that in your head, ready to think about, ready to engage with as the video is playing. And as you get to that point, it clicks in your head. You've seen those words on the whatever you're using, whatever device you are using, and then you go from there. So that's two repetitions in 20 or less minutes if it is a 20-minute video, and you keep going from there rather than play the video, pause it, write the notes down from there, add a minute to every minute on the video, make it a 40-minute video. So again, just the efficiency with it. And you mentioned this a few minutes back about how we've been using ChatGPT to actually act as a patient. because that's something in the hybrid program. We're obviously not all together every single day throughout the week. So why don't you touch, and obviously we can shoot back and forth, but why don't you touch base on how we have been using it to act as our patient and how we've been using it to role play with that?
Yeah, AI is crazy, and like, the craziest part is that it's just getting started, and like this is what we have already. But as you said, we don't have real life patients in front of us, or even necessarily practice patients in front of us 24/7, or at least a half the day as you would in an on ground campus. So recently, it's got to have has to have been in the last few months, right? Where ChatGPT put out this new
Yep.
voice feature where you can, I mean, you can choose the voice. I think you can choose languages too, like that kind of thing. And you give it all the information you want. Like if let's say you have like a little bit of case information that you kind of want to give it, say like you're a 45-year-old male presenting with shoulder pain with overhead reaching with a history of, hypertension, hyperlipidemia, family history of stroke, like all these things. Your job is this, you have a few kids, you live in a two-story home with these responsibilities. Like you give it this extensive list of things so it has some information to go off of, and then ask it to act as that patient coming into a physical therapy examination for this pain. And it will speak back to you in full sentences, respond to questions. Uh, it even will practice like influx.
Yep.
That's really interesting, based on like the mood of the sentence that it's giving you. So you kind of get some of those, like, it's not nonverbal, but like some of the additional context that you would get in that face-to-face interaction with somebody based on how they're speaking. And it's really cool. I mean, you get, because that first semester focus that we had on obtaining like the detailed subjective history from the patient, it's not easy. Like it's an art, really. I mean, a lot of the things that you need to know, the patient comes in with a preconceived notion about what you need to know based on what's going on with them. And they don't volunteer some things because they don't think it's relevant. So sometimes you have to figure out how to dig those things up. And that comes with practice, and you have to have those reps. So that tool has been really cool for a lot of people in our cohort, especially those who don't like have a roommate or significant other or a parent that they live with or something consistently, where they're willing to act in that way. And it kind of takes like, I don't know, I like to call it like the actor variable out of it, where like
Yep.
it's kind of goofy. Like we know we're throwing pieces in, or maybe we don't really know how to answer some questions in the right way as a patient would in that situation. And it's just a lot more realistic, from our standpoint. But
That's what one of the coolest things with that is that you don't know the patient. Like if you and your fiance are practicing subjective histories together, you know each other, you kind of have a sense of what information she has on the case, and you kind of know where the case is going already. Where you tell ChatGPT, you're a physical therapy patient coming to see me, and something is like your shoulder is involved. They make up the rest of the information. You can tell it to kind of surprise you with whatever information. You have to do your own digging. You don't know where it's going already. Like the element of surprise is there, and that makes you really work on your clinical decision making and your on your feet thinking and going from there on the spot again, rather than kind of knowing where you're going, which was what I felt before we were using this. I kind of felt like it was hard to practice the histories because it was okay, I've read through the brief history, I know the basics of the case, I know what to expect. ChatGPT gives us that element of surprise and helps us practice being able to think on the feet like that. And so, aside from the history, well, actually, I guess with that same thing, what I've been using is I've been taking the history, and you can say, okay, like, thank you for allowing me to ask those questions. You can wrap up the history and you can go give me feedback on that. And it tells you how you did. You can give ChatGPT those 9 EPAs, you can give them the course learning outcomes and everything, and it'll give you feedback in the way that we have been receiving feedback from our faculty and everything. So that it's purposeful. It's not just practicing just to practice it. It's practicing with the purpose and practicing with like a future endpoint in mind. So besides the history, why don't you go into the physical exam portion of it while still using the ChatGPT role play? Kind of how does that look like?
Well, yeah, because like you said, once you kind of wrap up that subjective exam and you maybe you get a little feedback real quick that you can then go into, like you said, the physical exam where obviously you can't physically practice these skills on, your computer, but if you think of the things that you would want to check in this person, like different ranges of motion. If you're a special test person, go ahead and ask for some answers on that and things like that, and palpations and pain points, and ask for descriptions of pain. Is this reproducing? Like that kind of thing. Every single thing that you can think of that you would do, you can ask ChatGPT for the outcome of that test. Like, hey, I'm gonna manual muscle test your shoulder flexion, your deltoid. Like, what's the score on that? It'll spit it back to you. Okay, next. And you just go, go, go. And you build out like a long list of these things that you would check, and it's giving you values based on the case that you gave it to. And I mean, it has all this, it has so much access to the internet information you've given it before, where the majority of these things are pretty accurate to what the context of that uh, presentation would be, which is really cool because then now you have all these objective measures. You've got your subjective exam, and then from those two things, I mean, you get to do your own interpretation and figure out which way you need to go with it, which is really cool. But
Yeah. And even from there, you go through that, you plan your management plan, and you can even kind of instruct the ChatGPT in your management plan and just practice the patient-friendly instructions on different exercises and different movements and whatever you're planning on doing. Like you can go through every single step, every single EPA with that, with immediate feedback and with basically everything you need, obviously besides the physical tactile portion of it, which you have to kind of you're responsible for that on your own. So with that, why don't we go into a little bit about that responsibility in getting that tactile practice? Kind of how you fared with it, how are you using it? What do you think about the responsibility being entirely on you? Just some of that.
well, my situation is different than most. Um, Having my fiance in the cohort where we can practice on each other. Um, but that is the hard part with like a hybrid model where we don't really, depending on where you live, you don't really see the rest of the cohort more than every few months. So a lot of that hands-on practice from like the video modules that we have in Physio U and different resources that are linked in Canvas, and the case application has some review boards where like you can submit some interventions and things that you do for faculty feedback, but it's all video, it's all hands off. So that piece, I think you can tell when we all come together who has done the work to kind of learn that stuff themselves and who hasn't, whether that's because they don't, have anybody to practice on it. Like that's just a reality of some people's situations. They might not. And then those who just haven't really gotten around to it for whatever reason. But then when we do all come together, the faculty are really good about with the way that our in-person immersion dates are designed, where there is so much practice. You're doing it over and over and over again on multiple people in the cohort. So it's not just one body, one joint that you're feeling. You're getting different feedback from all of your peers, all of your colleagues, and then faculty circulating to give little pointers on how they do things and what they would expect to find based on a certain pathology and things like that. So uh, it it's cool, but you do have to put the work in and the initiative in on your own
I,
end.
I
It's a little
think one of the cooler things I remember is in that first immersion when we were doing the joint play and the joint mobilizations and everything before we like truly learned about them. Like we learned about the osteo and arthrokinematics and everything, but we didn't truly learn about like mobilization grades, all that type of stuff that we have been learning about recently. I think the exposure that they gave us to that in that first immersion when we were all like, okay, cool, we get to play around with some joints and like get the end feel and everything. And then going back to the content asynchronously, getting that second repetition really made it all click, even though we had no idea what we were really doing in that first time around. We were just, I mean, we were getting the hands-on practice. I think, like you were saying, the way it's all set up with the immersions and everything has been very just fluid and making it all click, all work together. With that, same type of topic. I know you are also in a different position because of the work that you do right now. How has hybrid allowed you to continue working, to do your own thing? And how has that work experience? Because I know you're in the same field. How has it benefited your learning?
well, I think so. First off, I work in a couple different capacities throughout school. One being I do some like personal training type stuff through uh, my old physical therapy clinic that I used to tech at, and they have like a personal trainer position where a lot of the patients that finish up their physical therapy, whether they A, run out of visits and they're really not quite where they want to be yet, or B, they do like achieve their goals, but they want to like keep that. Like they don't want to downslide, they don't want to go back to where they were at. They like the environment, they like the idea of being, challenged and healthy and moving throughout the rest of their lives. So a lot of these people will stick around in that capacity, and that's where my job sits in that role in the clinic. So that's primarily, I'd say, the one that really has the most uh, carryover into our curriculum, just the populations that I'm working with and the one-on-one nature of it. But then I also do a little bit of uh, high school like team sports performance training on the side at another facility, which is cool in the sense that like the strength and conditioning principles stay fresh because of like how frequently I have to use them in that space. So then when it comes time to kind of reutilize those things back in the exercise prescription and thinking about like how does this work? How much like the dosing of things and especially if it were to come down to like an athlete rehab situation, I feel like because of that, it just makes that a lot smoother of a process when it comes to all really in just the assessment and exercise implementation, really pieces of it. But what's been cool with the hybrid program is I've been able to kind of organize my learning time around the work schedule that I need to have. So I have random like mornings that I go work. I have a full day on Friday that I work because we don't have any class. I have like afternoons where I go work for 1 hour with this team, and then I'll come back and I'll write some programs for my clients at the other job. So it's kind of sparsed out where it needs to be based on, client availability and just when everybody wants to come in and things like that. And the hybrid model allows me to move all of that asynchronous time with the lectures in between things where they need to be. And then on top of that, I think the way that, particularly more so with the PT clinic job that I'm still in, I mean, it's just an opportunity to like implement and see how things work. I mean, obviously, I'm not like advertising, physical therapy care in my role there, but a lot of these skills can be utilized in that space in a way that helps to cement them. And just, I mean, that piece where the personal one-on-one back and forth question asking, making changes, like applying interventions, seeing how they work, interpreting, nonverbal communication, and taking those things to kind of direct a full plan of care is often lost because of that lack of the personal piece in the hybrid program. So it's a really good place to, I don't want to say experiment, but I mean, kind of is. Yeah.
Yeah. And that's what I was kind of getting at, is that obviously you got to work, you got to support yourself through this program, you got to get yourself through the schooling. Your work right now is allowing you to get another repetition, and obviously it's certain categories of our education, of our curriculum, but it's another repetition every time you do that. It's another exercise prescription, it's another interview, whatever it might be. And with the hybrid program, I know one of our colleagues has taken the opportunity and taken the responsibility of getting that hands-on practice to go shadow. She's like shadowing nonstop, volunteering nonstop at different clinics. So it's really cool to see the different ways that our colleagues have taken that responsibility of being in the hybrid program and getting that physical practice and really owning it and making it to where they are going to be ready for January when we do start our clinicals and we do get going hands-on full time. So with that, I mean, we're running close to the hour here. Do you have more thoughts? Any other topics you want to hit on?
I mean, we could go a lot further with the AI, the time management, and how that pertains to practice once we're actually in it, but that's a whole nother episode right there.
Let's real quick, we'll wrap it up with, how do you think the development of AI and development of hybrid programs is going to impact the field? That's a huge question, I know, but in a brief sense, what are some things you kind of see happening? What are some things you think will benefit? What might be some challenges, real quick?
Mhm. Well, I think from my past experience being in a clinic and working with physical therapists and seeing what their workload is like and what things stress them out and what things slow their day down and what things are good and what things are bad, what things they're good at, what things they do and don't like to do. All of those things tend to kind of lead towards like the efficiency of technology and their use of it. Um, and I think that this hybrid programming, the ways that we've been talking about utilizing AI in our studies is it's not going to stop at the end of our our education. Once that carries into practice, I think that's going to allow us to kind of get that leg up right off the bat as it pertains to that efficiency with utilization of technology in our practice, whether that's like a huge thing where now we have like AI driven movement analysis and different, like testing softwares like that. Maybe it's not even that, but just like the ambient listening software for documentation and utilizing things like that to just cut down some of that excess time that often is put on the end of a physical therapist's day, takes over their lunch, delays their getting to the next patient, which then, is just one tick down off the therapeutic alliance because now they don't feel like you're prioritizing getting them in on time. Just these tiny little pieces of time that kind of add up into either A, poorer work as a physical therapist, or B, just burnout and not enjoying it anymore. So I think just the skills that we're learning now and getting used to implementing are going to carry over in that way where hopefully, I mean, we're efficient, we're enjoying our jobs, and we're getting people better.
Yeah, that was an awesome answer. Just the efficiency that we are creating in our studies is going to lead to efficiency in the clinic. It's going to give us more time to give our all to our patients, to get more patients better, I mean, it benefits everything from my point of view right now. But I mean, awesome answers, awesome discussion. I appreciate having you on here. Thank you for your time. Thank you for your thoughts. This is, again, Isaiah Van Denend. I will link his Instagram, link his contacts below. This is Dr. Giraffe Gainz, and we'll see you guys next time.